Thank you very much, Nino and Tony, for your very stimulating and thought-provoking presentations. Now, I'd like to welcome our panel of distinguished experts in the fields of epidemiology, public health, communications, policy making. And I would like to ask them to join me here, please. We have for epidemiology, Joel Schwartz, Bert Brunekreef, and Christophe Declercq. For public health, Aaron Cohen and Fintan Hurley. For policy making, Andrzej Kobe and Michael Young. And as a representative of NGOs, Denon Jensen. And for communications perspective, Marco Martuzzi and Yorgos Rembikos. Thank you. I would like to introduce this discussion saying that we have split it in three parts. One from the methodological point of view of communicating health impact assessment findings. Then from the public health point of view, from the audience's perspective, and we will end, if we can, with a few questions from you. And we should end by 5:30 or 5:40 at the latest. Thank you very much. So I will start. First, as I told you, I would like to address the methodological issues, and I would like to ask Bert Brunekreef, from what you've heard, Bert, can you tell us in a few words what you feel are the best way of expressing HIA findings on both mortality and morbidity today?
Yes, thank you. Nino in his talk already nicely summarized some of the thinking that Fintan Hurley, Michael, and I have developed in the last couple of years, so that doesn't need to be repeated, I think. I think that work has shown that it's methodologically more correct to express things in terms of disability, adjusted life years, and life expectancy rather than numbers of deaths or numbers of cases. The question remains how to communicate that concept best, and I don't have an easy answer to that question. I have been thinking that, we tend to think that the media want to hear the numbers and that the public wants to hear the numbers rather than the years of life lost. But I've been getting into the habit when I present about these issues, when I teach about these issues, to start my presentations with a very simple question to the audience, and that is, what matters more to you? What you're going to die from eventually, or how many years you're going to live in reasonably good health? I could ask it to the people behind the table or in the audience. I've been asking this to at least 15 different audiences of very different compositions. And with almost no exception, nobody chooses that they want to know what they're going to die from. They're much more interested in how long they're going to live in reasonably good health. Now that's an important message, I think, because that's what people feel is important to them. And yet we keep discussing, how can we calculate how many people are going to die from this or that.
Thank you, Bertil. Christophe, tell us, what do you think?
Yes, I agree with what Bert said. At the population level, I think attributable cases or deaths, it's an approximation because in the long term, the age structure will change, and so the number of deaths by year will decrease. But I see more the problem in the translation from population level to individual level. And when you say to the press or to the general public a number of deaths, they can ask, who are the victims? And we can't answer to this question because the whole exposed population is a victim because the exposure decrease the length of our life. But I think this question, who are the victims, is not as bad. Is not a bad question, and we should go beyond summary indicator of health impact, and to go to see who take who suffer of these effects, because the effect is not the mean effect on life expectancy for everybody. Some are suffering more because they are more exposed, more sensitive, and I think we should go to look at this in more detail. And if we think in the spirit of the theory of justice of John Rawls, perhaps we should check that the public policies to improve air quality, has bigger effects on the more exposed and the more sensitive in the population.